This is a guide on how to self-apply the SMI compression knee wrap. We have 2 frozen gel bags here and the pouch. I like to always fold the part with the hook up onto the back of the strap. That way, when you're placing the gel bags inside, the hook doesn't stick to the straps. So it's going to be a lot cleaner and easier. So we're going to take 1 gel bag and place it into each part of the pouch. This is important because it's going to keep the surgical site dry. It's an antimicrobial liner. It's also going to provide as a protective barrier so that it can go directly against my knee or my clothing. No condensation to worry about. The gel bags are fresh out of the freezer, so I didn't give them any time to thaw. So what I'm going to do is I'm just going to kind of mold them a little bit. Another way to do it is to just kind of give it a little mold around the forearm. It doesn't take long for it to get nice and squishy and able to thoroughly go onto any size joint. So what we don't want to do is place it so that the wraps are that the gel bags are vertical. We want to apply this so that the gel bags are horizontal. We want the logo to be around where that patella kneecap is to serve as a good guide. Doesn't have to be perfect, but if we want to get up and ambulate like I'm going to do some work, it's going to give you the best range of motion. The compression straps are always recommended because this is what's going to drive the cold successfully into the joint. It's also going to aid in extra swelling reduction. So I'm going to secure these so that they're nice and snug. And we want each top and bottom to go, over the entire wrap so that you're getting the most benefit out of it. Now, if I'm, a larger knee that I'm putting it on, or there's a dressing there, sometimes that hook may only go to the end. That's okay, it's still providing the same effect. So again, I'm going to secure this pretty snug because I'm going to get up and do some work. So, we stand up and just kind of test that range of motion, make sure it's not going to migrate or slide off when we're walking around. When we're done wearing it, always remember to simply pull the gel bags out, throw them back in their freezer so that they're ready to go for the next time. Also, you have your other set of gel bags in the freezer if you want to go to that continuous cold therapy.